Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Arlen Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. Well, welcome back to another exciting episode of the Health and Wealth Power Hour. I am your host, Harlan Pickett. Great to have you with us today. You know, when I was a younger man, I would say my buddy and I, Bill, were probably 19, 20 years old, and we worked with these guys that were in their 30s. And I can remember playing basketball at lunchtime with these guys. We worked outside. We had a pretty intense physical job that we would do in some days. But crazy enough, we're doing that, and we're out in the heat. And what do you do in the during break? Well, we would find a park somewhere and play basketball. Yeah, I know, made a lot of sense, right? Well, it's so interesting how at 19, 20 years old, we literally could run circles around these guys that were in their 30s. Now, both of them were actually better basketball players than us, but we were in much better shape than them. So our joke to them was, "You're too old. You can't hang. You're too old, brother. Come on, man. You can't hang with those young guys anymore." Well, you know what? It's a very interesting mentality that we had then, because I don't think anyone ever gets out of that mentality in the United States. We treat people like they're old, even when they're not. I mean, these guys were in their 30s. I promise you, when I finally got to 30, I'm like, I'm not old. And it is a weird mentality that we have, folks, of when we get to a certain age, we look at that age a whole lot different than we did 20 years before we got to that age. But as a society in general, we look at people aging, and we look at those folks, especially older than us as they're aging, with a little bit of a jaded view. We think that there is a decline there, when many times there's not a decline. We don't understand a lot of times because we haven't been there yet. We do begin to understand when we do get there. But many times, people are just as vigorous, or much more so, when they get older than they are when they're younger. My dad, for instance, he was very blessed to retire at 58 years of age. 2 or 3 years after that, I promise you, he was in much better shape than he was when he was working every day and sitting behind a desk. Now, he could have chose a different route and decided he was just going to sit on the couch and watch some shows. Well, first of all, Mom wasn't going to let him do that. But anyway, that's neither here nor there. But he didn't. He decided to remain active, and he still is to this day at 81 years old. I feel that has had a dramatic impact on both his health and, of course, his mental capacity as well. It's not diminished. Maybe he tells me the same story a couple of different times, but I'm probably guilty of that myself. My view of him hasn't changed because he's my father. But I really believe that I am not as generous in some cases to other folks that I'm not necessarily related to. I may look at someone the same age as my dad and not really give them the credit that they're due. Well, today we have an absolutely incredible guest who is going to talk about these subjects and much, much more. The author of the book, Keenagers. That's right, Keen with a K, Keenagers. Corinne Almond, welcome aboard the Health and Wealth Power Hour. We are so happy to have you.
I love that opening. I have so much to say already.
I don't know what made me think about, the fact that at whatever age we are, people are older than us are old, right? They're old, but as we get older, we're like, oh my gosh, they weren't really old. It's a funny dynamic that we have, and it's just weird to me. As I've got older, I'm 57 now, and man, 57 is pretty good. I mean, I'm doing just fine. Maybe I can't do the same things I could do when I was 37, but you know what? I still feel pretty good. I still feel pretty healthy, and I wouldn't want to be treated any differently, although I'm sure people do.
Yeah. So there's the fact that Yeah, old is always like 15 years older than we currently are. Just so you just keep kind of kicking the can down the road as you age. It's always moving. So there's that. And then the idea you were talking about the basketball players that you played and they had better skills than you. They were better basketball players. You were more physically able. And that's the other thing that, as we age, we develop all these skills. We get better and better at like all the things we are doing, but our physicality changes somewhat, but we make up for it in these other ways. And I think when we're young, our physical prowess is so good that we just think we're amazing and awesome, and there's nothing that could be better than that. And then as you get older, you start to realize, well, that was nice. I mean, that was fine, but I still feel good, and I've got now all these great skills that I've developed in whatever your areas are that often can compensate for some of those physical changes, because now you've learned how to adapt and get better at things. You don't have to have that same level of physicality. So I laughed when you were telling that story.
Yeah, and the honest truth is they beat us as many times as we beat them. They probably beat us more because of those skills. One of the guys' name was Brian, and he was just, he was making shots from all over the place. He just was really, really skilled, and that's it. So it's skill, but it's also wisdom, right? They were actually had enough wisdom to not run around because we were wasting energy. They just kept their energy and went ahead and just did their deal, right? They used their skills, but they had the wisdom not to just run around in circles like we were.
Right. Exactly. They're looking at you going, you're going to be tired. Stop doing that.
Yeah. This afternoon work, we're going to be ready to go, and you guys are going to be dead, right? When we get back out there and have to go back to work. So yeah, there's a lot to be said about those skills and wisdom that you learn over the years. And us at that 15, 20 years younger, not accepting it, not listening, not believing in it. It's the old joke of your kids don't believe you know anything until they get to a certain age, then they realize you knew everything. But it's the same thing, whether it's at work or whoever it is. I mean, it's amazing when you get to the point where you realize how smart your grandparents really were.
Mm-hmm.
And when you're younger, it's hard to see that so many times. It's also a funny thing. I go back and I look at some of the even TV shows that have looked at us this way. When the Golden Girls was on, they were all like in their 50s.
Mm-hmm.
But they were all old grandmas, right? It's hard for me to even imagine that now. But it's just the way our society looks at it and has for forever, really.
Yeah. Well, and it has changed. It has legitimately changed in the sense that, we live much longer lives now. Our longevity has increased. We have more older adults than we've really ever had in human history. That's been documented. And so our concept of what it means to be an older adult hasn't necessarily changed, even though older adulthood itself has changed. So we're living longer, we're healthier for much longer of that period. When Social Security was first enacted back in the 1930s, the average American male lived to about 67. That was our expected lifespan. So we were planning on you to retire at 65 and get Social Security for a couple of years, and then it was going to be over. Now our life expectancy is like 76, 78, depending on if you're a man or a woman. And that's in the United States, obviously. But, now you're looking at a decade or more that you would be in this time period of older adulthood, retirement years. So it has legitimately changed the way we think about it, our stereotypes, our concepts around it have not changed as quickly as older adulthood itself has changed, which is why we kind of end up in that moment like you just had with the Golden Girls. We're like, what? They're in their 50s? That can't be right. And because today, 50 is young, especially in my world. I mean, you're a baby at 50.
And it's very interesting because I do believe our mentality has changed. I think you agree there, but I believe it is because the workforce and such has got older. That's the truth too. As people are living longer, people are working longer, some because they want to, some because they have to, there's no doubt, but some because they want to. If I'm still able to do my job, and I talk to people all the time, I do some consulting work for an organization that helps federal employees retire. And I talk to people over 65 all the time that are like, well, maybe 2, 3, 4 more years. I mean, I kind of like my job, or I don't like my job, but, I talked to a gentleman yesterday, but I got a 14-year-old daughter. He's 67. I got a 14-year-old daughter. I need to work until at least she's in college.
Yep.
Okay. So it also shows people are starting families later. There's a lot that's going on in that situation where he still is very able to work. I mean, he even told me, I'm in great shape. I just don't really care for what I do necessarily, so I'd like to have some other options. I gave him a couple other things that he could do, but the bottom line is he can still work. He still wants to work. Just sometimes you don't like what you're doing, right? So there's a little bit different there. But that's business itself. So let's jump into that real quick, because ageism in business, while it's not, I think, as bad as it was 20 years ago, there's still some of it there. You still hear of people that were let go when they're 60 years old, and man, they have a hard time. Even though they have all this great experience and all this great knowledge, they have a hard time finding another job. So talk a little bit about that and kind of what your thoughts are around ageism in business.
Sure. So I think that experience is incredibly common. Even people in their 50s who get laid off from a position have a lot of difficulty getting rehired again. There's good research out there that shows that hiring managers, if they know your birth date, will just not even interview you, because it's because of the perception that someone in that age range is going to want too much money, right? They'll be too expensive and we can't afford to hire them, or they won't be flexible. They won't be willing to learn. These are the stereotypes.
Yeah.
When in reality, the people in that position, number one, might be willing to accept less money because, a job is better than no job.
Right.
And number two, they're bringing a certain skill set with them, but that doesn't mean that they aren't adaptable. I mean, the idea that you can't, teach an old dog new tricks is absolutely ridiculous. They are willing to learn. They are willing to adapt. And then they're going to bring a certain level of wisdom and skill set with them into the position. So, and a lot of times people love to start something new, right?
Yeah.
Like you were saying, that guy didn't really like what he was doing. He's ready to try something different. If somebody offered him a job where he got to learn something new, he might be really interested in that because it's refreshing, right? One of the things we see happen with older workers, and it kind of becomes a self-fulfilling prophecy, it's like as people get into the later stages of their career, like let's say they're in their 50s, their employer starts looking at them and saying, well, we don't really want to continue to invest in them with like professional development and things like that because they're probably getting ready to retire, right? And this is not a conversation they're having with the employee. This is just like the management or whoever's above them going, they're probably getting ready, so we're not going to really invest, or we're not going to offer them promotion because, they're 1 foot out the door already. Whereas the employee may be thinking they're going to work for another 10 years. They're not thinking about retirement at all. But because their employer is not investing in them, they're getting bored and maybe kind of listless in that job. And so then the employer's going, well, they're not really performing like they used to. And so that, you see what's happening.
Yeah.
It's this kind of self-fulfilling prophecy. And what really should happen is there should be a legitimate conversation between the employer and the employee where we say, hey, what are you thinking about in terms of retirement? Are you thinking you're going to be here another 10 years? Are you thinking, you're going to retire sometime soon? And maybe your employee won't be honest with you. Maybe they will. Who knows? But we really should be normalizing having those kinds of conversations so that if somebody says they want to continue to work for 10 years, the employer continues to invest in them. They get interesting assignments. They get interesting work to do. And, then we can all have a very positive interaction compared to, well, I'm really bored at work and they don't really seem to care if I'm there, and that kind of experience. But yeah, and then once you are out of a job, it is very difficult in that age group to get rehired. I've met with several people who just ended up actually starting consulting work or starting their own business because they could not find employment again. And so they said, well, you know what? I'm just going to go do it on my own. And that has worked out for them really nicely, but it was really scary when it was happening.
Sure. And I agree with you. I can't tell you how many people I've talked to that eventually just said, or it actually came to me in many cases and said, so tell me what it means to be a 1099 employee. Tell me what it means when I'm a contractor versus working as a W-2, because I'm getting offers, but all of these offers are for me to be a contractor. How's that going to change for me? What's that going to look like? Well, that's what I've been for 20 plus years. So I got you, man. I can tell you what the ins and outs of it and tell you it's going to be a little bit, it's not going to be a whole lot different than having a real job, but here's what's going to be. It's a job, man. It is. And you have a lot more flexibility and control now over what that looks like. So it's not necessarily a bad thing, but it is a place that I have seen someone getting in a little bit in those years. People will do it. People will hire you more as a contractor, as a 1099. Even if you're doing full-time kind of work, they'll still look at you and give you that because, interestingly enough, they value your experience in that position, and they'll actually pay a little bit more because they don't have the burden of benefits and things. Right. But that's also the downside for someone in that age because the benefits are a huge part of why they need that job.
Yeah. It's because try getting health insurance in your 50s when you're not too young for Medicare. But if you try to buy your own policy, right, that is going to be pricey. Very pricey.
It is. That's part of the folks that I help every single day. And I'll tell you, the crazy ones are when someone calls you up and like, all right, I'm leaving my job and I've decided I'm going to retire. I'm 63. My income's going to be okay. They're like, okay, so what do I do for health insurance? I'm like, well, or can you help me get on Medicare? I'm like, well, you ain't Medicare yet. You're 60. Oh, I thought I could be on Medicare when I retired. Or when I'm 62, I'm like, that's Social Security. You can get Social Security. You can't get Medicare. Well, what do I get for insurance? And you show them what the cost is. They're like, oh, yeah, can't retire anymore. That's my entire pension right there.
Yeah, they're saying suddenly the income doesn't look sufficient anymore.
Exactly. I'm like, 2 years, 3 years, you got to get to 65. I can't tell you how many times, Corinne, I've had to tell someone, you got to get to 65 because what you have invested, what you're doing here is going to be wiped out, or a lot of it. 50% of it's going to be gone just paying for health care. And it's a crying shame that it's that case. That's the way it is, but that's the case in so many people's situation.
Sure. Well, and that's also probably one of the reasons employers are also reluctant to hire older workers, because if I do hire you as an employee, it's going to make our health insurance premiums go up as a company. And that's something people don't think about, is that when you're running a business and you have employees and you're helping to pay for their health insurance, the age of your employees is going to determine the premiums that you're paying for that health insurance. So it actually discourages businesses from hiring older workers, because we know if we do, when we put you on the health insurance, is going to make our premiums go up for the whole company that the business is having to pay. And so that is kind of some of the behind the scenes that even I didn't realize until my husband and I both run our own businesses. And as business owners, you start seeing those prices and you're like, oh, right. Like this is a issue. Like I want to hire this person, but also this is what's going to happen. It's not just their paycheck and their part of the benefits. It's the overall cost to the business.
That's exactly right. And it is overlooked. You're right. Especially some newer businesses that we've seen, start up, and they want to hire someone that's got some experience. And when they decide they want to offer benefits, they can't believe that one, 58-year-old that they hired because of his knowledge, and everyone else is in their 20s and 30s, has had that dramatic effect on the rates. It's interesting because, and this is a little known thing, maybe you understand this as a business owner, that 58-year-old, male or female, it doesn't make any difference. A 28-year-old female is actually going to kick the rates up almost just as much because she's in her childbearing years, and they take that into consideration too. So it's kind of a strange little thing to look at. But, in group insurance in particular, there's typically, depending on the size of the group, there's typically not underwriting involved. And so the age is all they have to look at. So that's why you can see such a dramatic difference. Is all I can look at is age, and the numbers, the actuarial numbers tell me that if someone gets older, they get sicker or more likely to have these things happen. So I have to give you higher rates, even if this person is perfectly healthy.
Right.
Because I can't find out that this 50-year-old is actually a marathon runner. I can't get that information. Right.
Matter.
Just like I can't see that the 32-year-old weighs 400 pounds.
Right.
So the 32-year-old is actually a bigger risk to the group than the 58-year-old, but I don't have that data. All I have is ages.
Right. I mean, that's what we're working with. Yep.
Yeah, exactly. Well, let's slip into healthcare then, because we talked a little bit about health insurance there, but let's talk about ageism in healthcare, because it is certainly there as well. We talked about Medicare because, in the United States, if you're eligible for Medicare, you hit 65, you really don't have much of a choice. You have to get on Medicare. This does not always apply to people who have or work for a large employer and have group insurance, but pretty much everybody else, they fall into that situation. Well, now you are beholden to Medicare rules, and you can only get treatments that Medicare says that you can have. And, we talked a little bit before the show started. That includes situations where they say there's certain screenings that you don't need anymore because you're at an age where you don't need these screenings anymore. That can be quite a shock to the system for someone when they get to a certain age. They're like, nah, we don't need to screen you for cancer anymore, but if you get it, we'll treat you.
Right.
What?
Right. Well, so and I had told you the story with my mom. I don't remember the exact age she was, somewhere in her 70s, that she went in for like her annual visit, and they, all the normal screenings that they typically do, they just said, oh no, we don't do those anymore now that you are whatever the age was. And she's like, what do you mean? And they were like, well, Medicare won't pay for that anymore. So if you want them, you can pay for it out of your own pocket, but your insurance doesn't pay for it anymore. And to your point, her number one, there's nothing that makes you feel less valued than somebody saying, well, at your age, we're not going to screen anymore because, like, it doesn't really matter if you get cancer, right? And I know that's not exactly what they're saying, but that's the way it feels.
Yeah.
And to your point, why wouldn't we continue to do the screenings unless there was some big risk to the screening or something? Why wouldn't we continue to do it? Because if at some point we find that she has cancer or whatever the illness is that we're screening for, we're still going to treat it. So wouldn't it be better to find it and treat it early so that we spend less on the treatment than let it get bad and then have to spend, multi-million dollars on treatments later? So it, in my mind, at least, it doesn't make a ton of sense there. But I also think, as we've discussed earlier, Medicare, maybe hasn't changed as much as it should have in the last 50 years. As people are living longer, as people are living healthier longer, they really haven't necessarily adapted those rules to those changing situations either. But ageism in healthcare is even more basic than that. Ageism in healthcare is like when you go to the doctor and you've got an ache or a pain, and they just say things to you like, well, you're getting older. Aches and pains are to be expected. And it's incredibly frustrating because you want to say, yes, I am getting older, but could we also investigate to make sure nothing else is going on here, right? And that kind of stuff just happens all the time. And it's, our doctors and nurses are stressed. They're in a high pressure situation. They're, they got 10 minutes to spend with you. So I'm not trying to poo-poo them at all. Also, they have grown up in this same ageist culture that we have all been experiencing our whole lives. And so they are subject to the same age biases that everybody else is. So as we get older, we should be prepared to have to advocate for ourselves a little more, or to advocate for our aging loved ones a little more at the doctor, because the likelihood that we might get blown off a little bit because of age bias is pretty good.
Yes. So going down that pathway in the healthcare arena itself, especially with physicians and nurses, maybe they see folks a little bit more these days, unfortunately, in a lot of cases. How much do you think an impact is of them seeing, and I'll say this in a way that I think you'll get this. There are people out there that are an old 60, and there are people out there that are a young 60. And then most people are kind of in between, somewhere in there, right?
Yep.
But how much do you think the impact is of them seeing a lot of sick people, right? They see a lot of the old 60s and them just naturally treating 60-year-olds as old 60s. And I think that's right, because who do you see more of? You see more of the sick people. If you see more of the sick people and they're this age, then it's hard to, I think, separate the people that are not having those same issues and they're complaining about something. You're like, oh, you're not 18 anymore.
Right. No, I think that's a very fair point, in the sense that they're going to have a propensity to see a certain group of 60-year-olds because they're the ones who need more treatment, have more chronic conditions, because they're as you put it, the old 60. The young 60 aren't in the doctor's office, right? They're out doing stuff. They're still working other things. It's also true that most people, when they go through medical school or their medical training, get very little or no training in geriatrics, how to work with older people, how to work with complex chronic conditions. And when you survey doctors and ask them about like who they want to work with, older adults are not their first pick. And geriatrics in general is one of the poorest paid specialties. So there's not a lot of incentive to want to train and learn to specifically work with older people. But it's something we really need because of the growing population, right? We need more, and instead we have fewer because they're so poorly paid.
Yeah, the numbers, I'm not sure they've changed too much. About 10,000 people a day are turning 65. And I mean, if you want to just use that as a benchmark, because then they're qualifying for Medicare. I mean, I would imagine that most people that are 65 would not want to be called a geriatric, but I mean, you think about that. I'm 57. I'm pretty sure 65. I don't want to be called that yet. But our definition of that has changed too over the years because people are living longer. My dad is the youngest of 11 kids, and he's 81 now, but he's already lived longer than any of his brothers, sisters, mom or dad.
Yeah. But here's the thing. You said it's changed. But here's the thing. Our language around older adulthood has not changed. So if you are 65, you're geriatric. You're an older adult. If you're 95, you're geriatric. You're an older adult. The language is the same for people who are 30 plus years apart in age. And now we know, you and I know, that 65-year-old is going to be way different than that 95-year-old, right? They just are. But we don't talk about them like they're different. We call them all older adults. We call them all geriatric. It's so difficult to try to talk about growing older because we don't make a distinction. And there is no other time in life when we would be saying that people 30 years apart are in the same group, right? Like this would be like a 12-year-old talking to a 42-year-old and saying, hey, we're basically the same thing, right? We're basically the same age. So, this is one of you mentioned the title of the book, Teenagers, and people sometimes love that word and sometimes they hate it. And I get it. New words are hard, but the reason I advocate for teenagers kind of talking about our younger, older adults is that I'm saying we need new words, right? We need new ways to talk about growing older, and who different groups are in older adulthood, because right now we really don't have it. There's very few positive words associated with older adults. Maybe active agers. My local senior center just changed their name from the senior center to the active aging center, and now they're all active agers, which, okay, I get it. They're trying to be more positive. You may love that one and not my word. Okay, that's fine. But we need different language to talk about people who are 30 plus years apart. And just a funny side note, so I'll be 50 next year, and my mom is 79. And next year, both she and I were 30 years apart. She and I can both go to the senior movies in her hometown for free, because we're both seniors starting next year. And I mean, and I'll go to the free movie. That is not going to hurt my feelings at all. I will be happy to go to the free movie. But also, I mean, you kind of have to laugh at the ridiculousness of 50 plus, in this case, is seniors. And my mom and I, who are 30 years apart, can go to the movies together for free. Cool. Great. Let's have a great time.
We went to play putt-putt golf a couple of years ago. I just turned 55, and my daughter looks up and goes, "Dad, you get $2 off." What? And she's like, "Yeah." And she goes, "But you probably don't want it." I'm like, "Heck yeah, I want my $2 off. You buy $2 off. If 55 gets me $2 off, I want the $2 off."
And I'm going to go to the free movie. I mean, absolutely. I'll do it. But so you're going to get that $2 off for the next 3 to 4 decades of your life.
Yeah.
Right? Whatever, we're not talking about a couple of years. We're talking about decades, multiple decades for most people. And that's the part that how we have conceptualized older adulthood, when we say it starts, how we talk about it, just has not kept up with how life has really changed.
Agreed. But I think even thinking about ourselves, it's kind of a funny deal, because some people look at themselves as they're a young, whatever they are, right? Doesn't matter. I'm a young 57 is what I'll say. But other people do look at themselves like, "Man, my shoulder hurts, my knee hurts, and I can't believe I'm the same age as you." Like, well, yeah, I don't know what to tell you, but first thing you got to do is just change your mind and, get that out of there. But it is interesting, because I'll talk to people that cannot believe that I'm the age I am. I don't think that I necessarily look younger. I think because I'm active and I'm kind of outgoing and outspoken, as it were, that I'm doing a young man's thing, I guess. It's kind of I don't know a better way to say it, but it is interesting that I know people that are my age that, I'm not saying I'm the most active guy, but that they just don't do anything. Correct? They don't do nothing, and then wonder why they can't do nothing.
Yeah. So the point you made about changing your mind, and this applies to a lot of areas in life, but changing your mindset about aging and your outlook on it is imperative. Like, absolutely. There is research. Dr. Becca Levy up at the Yale School of Public Health has done basically age bias research, looking at how people's internal perceptions of their own aging. Do you have a positive outlook on your own aging, or do you have a negative outlook? So are you looking forward to growing older, or are you saying, "Oh, it's all downhill and it's all going to suck and it's going to be terrible," right? And her research is fascinating, because she finds that people who have a positive outlook on aging walk faster, recover better from accidents and injuries, live on average 7.5 years longer than people who have a negative outlook. I mean, she has a book, it's called Breaking the Age Code, and she just goes through all her research studies looking at this. And I mean, just basically everything is impacted by your outlook on your own aging. But so again, kind of becomes a self-fulfilling prophecy in that if you're telling yourself it's going to be terrible and horrible and it's all downhill and it's all, there's nothing I can do, well, then it kind of ends up being that way versus having a more positive outlook where you stay active, take care of yourself, all these simple sort of everyday decisions that you make that are different when your outlook about growing older is positive versus when it's not.
One of the things that you touch on in your book too is navigating the journey for caring for your aging parents, right? You're navigating their journey. But what you just touched on is a little bit different. That's navigating your own journey as well, because that's obviously very important, without a doubt. And how much of navigating your loved one, your parents' journey, how much of that do you see having an impact on people better understanding how to navigate their own?
It's huge. So I think a lot of people in their 50s, my age group, your age group, we are watching our parents, because our parents are really the first generation that is living this long, right? Like, I mean, we've had a few people live this long before, but now we've really got like a whole generation, and we're watching them do it. And some of them are doing it really well, right? And some of them are not doing it well at all. And I tend to end up working with, in my care management practice, I end up working with a lot of the adult children whose parents did not plan well, did not look ahead, did not take care of themselves. And so now there's like a crisis and it's a big hot mess and we're trying to figure it all out. And those adult children are watching that and going, oh, I don't want to do this, right? I don't want to ever put my own children through this. And so they are starting to plan, to prepare, to do all the things. And I'm going to go back to the mindset thing here for a second. Your mindset about growing older will also determine whether or not you plan and prepare for growing older. So I see so clearly that people who are looking forward or have a positive outlook on their own aging, they do all the things they need to do. They do their will, they do their power of attorney, they financially plan, they plan for their retirement socially, emotionally. What am I going to do that's fun? Am I going to keep working? Like, they're thinking about all this, about how to make it good because they're looking forward to it. And when we have that negative outlook, we kind of bury our heads in the sand and we go, I am not going to grow older, or I'm just going to die warm in my bed. And I don't really need to plan for any of that because, I don't want to think about it because I think it's going to suck. And so I don't want to talk about it at all. And then guess what? It does end up being terrible.
It sucks.
But yeah, I mean, I see a lot of adult children kind of watching this stuff happen, watching the train wreck happen, and they're like, oh, we're going to fix this. And it changes their outlook because they see how it can go wrong and they go, I'm going to do this better, right? Like, I'm going to get all my ducks in a row ahead of time.
So how often do you see it whenever the parents have done everything right and they see that and also learn from that?
Yeah. And I don't see that as much in my care management practice because when people have done that, they don't end up needing me. But I do see it in just like everyday life. And I do get a few people in that business where they call us way ahead of time. So like these are older adults who are maybe in their 60s or early 70s. And they're saying to me, I need you to tell me all the possibilities of like where we might live and what kind of changes we might need to make to the house and all these things. They're planning ahead. And I love clients like that. That's an amazing client because I can help them get everything ready, right? And to think ahead about, well, if this happens, then this, and if this happens, then this, and, and if none of that happens, then, and that's such a pleasure to do. And a lot of times the adult children are involved in those conversations too. And they're so grateful. They're so grateful that their parents are taking those steps and thinking ahead, and that they can see the kind of planning process happening.
So you help folks plan for this. This is part of what you do, I guess, consult with them on steps that they can take and such. One of the things that I've certainly noted, not just in my family, but in families that I have worked with, is that as we get older, as our parents got older, they accumulated a lot of stuff. a lot of stuff.
Yeah.
My dad still sends me that meme every now and then where the guy's standing at the garage with his little bitty child looking in there with all these cans of screws. And he goes, someday all these will be yours, right?
Uh-huh.
Well, that's actually an honest to God view of me and my dad, like looking inside his garage. That's neither here nor there. What really happens is people accumulate a lot of stuff. And then it gets very, very, very difficult for them to start letting that stuff go. What is your advice there? How do you help people navigate through that side of it? Or do you help them navigate through that side of it? Because, man, that is a tough deal when there's downsizing now and they've got to start letting some stuff go.
Yeah, so there are professional people for that.
Yeah.
Senior move managers often help, or downsizing estate sale type people who specialize in that. So I don't typically do that myself, but I will refer people to others who will. My advice for older adults as they are thinking about that is to just try to do a little bit at a time. Like start with one room and start going through it. The hard thing is when they think everything they have is really valuable and they cannot see getting rid of any of it because it's all valuable. And at that point, you may not be able to get rid of it until later because they think those trinkets that they have they were collectibles and they're worth millions, and you just can't always convince them that that's not true. But if they're willing to downsize, there are definitely people who will help with that.
And I guess my point in bringing this particular thing up is that a lot of times this is not addressed until the downsizing is maybe moving into a senior living facility, until they've got to the point where they can't take care of themselves or they won't take care of themselves or whatever, fill in the blank there. And then it becomes a point of contention, because that's what I have seen is then all of a sudden the children and the parents are having a bloody battle, as it were, over their stuff. And it's sometimes the parents already had to be moved to a different home. And so now the kids are back in the house trying to figure out all this stuff, and they're at loss also. So I guess my thought on that is, if someone's willing to talk about these things, if they're planning these things, this is something that needs to be addressed too, right? This is a plan put in place to know that someday there's going to be a downsizing, needs to be part of your plan.
Yeah, absolutely. Absolutely. And, kind of trying to get ahead of that is such a gift for your adult children, because they're the ones going to end up having to deal with it if you don't. But yeah, it absolutely should be part of the plan. And actually, I think if we look at it as empowering to say, okay, I'm going to make sure that things get where they need to go, like to whatever members of the family, or I'm going to get this stuff sold off so that we can collect all that valuable money, right? So that I can pass it on or use it for my care or whatever. If we can kind of reframe it from, we got to get rid of all your stuff, to more, hey, we want to make sure that this is your legacy, and the things go where you want them to go, or that we get them sold to the antique dealer or whoever, so that we can get the money and use that for your care, or use that for the grandchildren, whoever it is. That tends to sit a little better than just, let's get rid of all your stuff.
Yeah. No.
Even though to the adult children, a lot of times it just feels like a lot of stuff.
Absolutely. Well, you brought up, and we kind of brought up here, senior living facilities, different places where, sometimes not all are the same. Sometimes it's more like an apartment for people that are 55 and older. I know that's good. There we go, back down to that age again. Sometimes they have skilled nursing on there. There's a higher level of care. Then of course you get to the ultimate where it's nursing home type facility. But not all, anywhere in that spectrum of all these different things, not all facilities are the same.
Oh, heavens no. Yeah.
So navigating those different senior living communities, what do people need to know about that? What's some sage advice you can give when someone knows this is in our future, even if it's not today? I mean, sometimes it is. It's like right now we got to do something. But what is some sage advice you can give to folks as they're navigating that potential those possibilities?
So if people think they're going to want to move to like a continuing care retirement community, so these are the really big retirement communities, and they have all the different levels of care. They have independent, assisted, memory care, skilled nursing, everything on one campus. And they tend to be really high quality care. So people like that. But because they are high quality care, they also tend to be pricey. They're expensive. And they tend to have wait lists, especially right now with the boomer generation coming into older adulthood and starting to move into some of these communities. They're building apartments and cottages and townhomes as fast as they can, but there are still significant wait lists. So if you think something like that is appealing to you, you need to look 5 years before you actually think you're going to want to move, because you need to get on their wait list. And once you get on their wait list and stuff, you usually can go and start like participating in the activities and like meeting the people who are there and all that. But people wait too late. They always wait too late. They wait until they're ready to move, and then they find out that the wait list is 5 years long. So don't do that. The second thing is, the people who are not planning ahead in that sense, who are looking more in the kind of crisis moment, right? Something's changed. Now we've got to move to assisted living. We've got to move to memory care. The biggest thing is shopping around and dropping in on these places when you have a tour, but then also when you don't have a tour and you can just pop in and see kind of what's happening, talking to the staff. How long have they worked there? Because we want to see about turnover, right? Is there really high staff turnover? Things like that. But typically what happens is if we get a call and somebody needs to move quickly, families, they don't know the difference in assisted living and memory care or skilled nursing. Like people will call all the time and say, my mom needs memory care. But when we actually talk to them, their mom's not anywhere close to needing memory care. She just needs some reminders every day, right? Some prompts to okay, it's time to get dressed. It's time to do these different things. And memory care is for when you are much farther down that road of dementia than just that stage. So, you really are going to have to take some time to get educated about what level of care is appropriate and then which building offers that, because people will call all the time and they'll be like, well, we were thinking about going to that pretty one that's on such and such road. And it's because they drive by that one every day. But then when we talk to them, it's completely wrong level of care, right? Like they need skilled nursing and that's an assisted living. And so there is a bit of a learning curve there that you can get professional assistance with. It's not something that every day people just want to know. People generally don't want to know until they absolutely have to, but get some professional guidance when that moment occurs.
So one of the things that we see on the healthcare side, and whenever we build health plans, whenever we work with employers and employees and all this, is it can be very difficult just looking at your plan data to determine a quality facility, because scoring, what you see on Google is not really a quality score of a facility, right? It doesn't tell you how many infections and that a hospital has. It doesn't tell you what their mortality rate is. It doesn't tell you what their readmission rate. It doesn't give you that information. Most people don't even know to look for it. Is there some way to look for quality scores, true quality scores of these facilities? And how important is that, do you believe?
So in North Carolina, there's a star rating system, and that I'm in North Carolina. And so you can look online at the state's star rating system for different facilities. It's really hard because I know some really good communities that have a low star rating system because one memory care resident pulled another memory care resident's hair, and so that is technically considered assault, and so they got downgraded because of that assault. But they're memory care residents, and unless we're going to keep them so completely isolated, like they may have fights and not get along with each other, and may pull one another's hair occasionally, and that's not ideal. But at the same time, did a community that had overall really good care deserve to get downgraded because of that incident, right?
Sure.
So there's that. And then there's also communities that have pretty high ratings that I'm not sure sometimes how they have maintained that. So I think you can look at the ratings. I think you can also look at Google reviews. I always tell people, if you're looking at Google reviews, remember that normally we leave reviews like that when we're angry, right? When something's gone wrong. When we're really happy, we're not nearly as motivated to go make Google reviews. So I say look at all of that, but take it all with a grain of salt, because no review system is perfect. So look at the reviews, and then go look for yourself. Because the other thing that happens is that these buildings can change at any time. The amazing nurse who was coordinating all the care, she leaves and everything in the building changes. Or they get a brand new, that everything's been in chaos, and then they get somebody who comes in to coordinate all the care, and they're amazing. And so now their reviews are still real bad, but she's turning everything around and it's terrific. So just because somebody else had a really bad experience doesn't mean that you will, because everything in these buildings can change at any moment based on who's working there.
And see, that's the negative with anything where you can't get true quality scores, right? I mean, that is one of the things that I do like about our ability in general. You can't just do it out in public. Even like you're talking about the state of North Carolina, well, CMS or Medicare, they have ratings for hospitals and such too.
Yeah.
But they can have a great rating on something, and then their patient safety rating through Leapfrog is terrible. And we see those things because they look at different things.
Right.
So it can be very difficult to find that information. But I was just curious if there was anything out there for these type facilities that actually showed quality and looked at the healthcare in particular, because that's obviously that's a big deal if you're going to an assisted living where there is healthcare on site. Typically, you're seeing your doctor there. All your services are right there now in many cases. So I was just curious.
What you're looking for is a deficiency-free survey, right? When the state came in, did they get a deficiency-free survey? I mean, that's the top. That's the best you could possibly get. And so if a community's got that, they will blast it from the rooftops that they had a deficiency-free survey. And that is fantastic. I'm not poo-pooing that at all. But also, if things change in the building, it can change at any time. But I mean, if that certainly is a very good indicator that they are trying really hard to provide quality care.
So in those particular facilities, you work with a lot of those, right? You work with a lot of these facilities. Is that correct?
Yep.
Do you still see in those facilities some of the same biases and ageism, as it were, that is in society? You would think if there was any place that it wouldn't be as bad, you would think it would be in a place that this is the folks they deal with all the time. What do you see?
I think, number one, that the people who work and live in these communities are still in the ageist society that we all are in, right? They're not isolated from it. And we're all ageist, right? We all are, because we've been cooking in this for so long as we've grown up. I mean, it's very hard not to be. Number two, to your point earlier about doctors really seeing the sick, the old 60-year-olds versus the young, healthy 60-year-olds, that's what they're seeing in the community, right? They're seeing the people who have a lot of health conditions that they're not in good shape, those sorts of things. So it can contribute to that age bias, because that you're seeing a very specific population day in and day out all the time. And that's, I could tell you stories about things that, like, people who, there's one lady that's a good friend of mine, and she's probably in her 70s now, and she has worked in senior living her whole career. And she, up until about 2 years ago, and the last community that she worked in, one of the reasons she left was because the staff was talking so negatively about, ageist comments about the residents, that she felt very uncomfortable, because she said she sat there in like a staff meeting where this was happening and was like, do they know how old I am? Do they know that I'm the same age as these residents? Like, she was, because they were being so negative about it. And so it does happen. It absolutely does. And now I do think that a lot of people who work in these communities go into it because they do really care about older adults. But just caring about them doesn't mean that you're not still ageist, unfortunately.
Yeah, I mean, think about that. Most people that go into healthcare, same thing, whether it's that type of facility or they're just in a hospital or they're working in a doctor's office, doesn't matter. When they go into healthcare, they're going to help people. But a lot of times, just the environment that they're in, it can be so negative that they start wondering, what have I done? You mentioned earlier, you only get 10 minutes with a doctor. I mean, we're seeing so many physicians that leave and get out of that now because they don't feel like they can properly treat and have a relationship with a patient because of that.
Right.
I mean, we're huge proponents of direct primary care, which of course, then you have a relationship with a physician now. It's a membership model where you're not using insurance anymore. You're actually getting the care that you deserve. Right. And it really makes me think, in this case, the different journey. So I think about even folks that I know, including one client that I had, that I told him, you're taking too many medications, brother. I mean, I've got 22 medications on this list, and half of these are to counteract the side effects of the other half. And he got so mad at me because he told me, I've been seeing this doctor for over 20 years. He's got my best interest at heart. You don't know what you're talking about. You're not a doctor. I know I'm not a doctor. I'm not trying to tell you. I'm saying, why don't you go get a second opinion? Why don't you go see somebody else?
Right.
And he got so mad at me, he didn't talk to me for 2 years. And then, I was his agent. I helped him get a Medicare plan. And then he called me up and he goes, hey, I need you to get me a new plan. I don't want this one I'm on anymore. I don't need it. I said, oh, okay, Bill, what's going on? He said, well, I've lost 50 pounds and I don't have diabetes anymore. I said, what? I said, your doctor told you you're going to have diabetes for the rest of your life. You need to suck it up, buttercup, right? He goes, yeah, that's what he told me. But then I went to that doctor you told me to, direct primary care. He says, he gave me all this time, helped me change my lifestyle. I lost all this weight. I'm not on any insulin anymore. I'm not on metformin. And he told me there ain't no reason I couldn't live another 15 years. One doctor is trapped in the system and can only give you 5 to 7 minutes. The other doctor is giving the guy an hour at a time to make sure that he's being taken care of.
To address the whole patient.
The whole thing. All the things.
Which becomes even more important as we do get older, and our health changes. If we have chronic conditions, we need to be looking at the whole person so that we can manage them as a whole person, not just your neurologist and your rheumatologist and your cardiologist and all the things that don't even talk to each other.
Exactly. And I cannot tell you how many times that I have heard someone say, I went to my doctor and they gave me this medication and then I had this reaction because he didn't know I was taking this other medicine that my cardiologist gave me. Mm-hmm. Well, you fill out these forms and you're supposed to tell them those things. She goes, well, I didn't even think about it. I figured they talk to each other. And to your point, Corinne, they don't ever talk to each other. They don't even have any idea what's going on. Unless they referred you to that cardiologist, they didn't even know you were going to see them.
Right.
So there's so many things that are disjointed there. And my whole point of this is to help you on your journey. There is some part that is your responsibility to make sure you're getting the care that you need and that you have, that your care providers are truly engaged with you and have your best interest at heart and are not just treating you like someone that's another 60-year-old, another 65-year-old. They're not treating you that way. They're getting to know you, have a relationship with you, and you're getting the care that you personally need, a holistic care of yourself, not just this is how we treat people this age.
Right. Right. Hey, if you've met one 65-year-old, you've met one 65-year-old. That's it. Overprescribing your 22 medications, overprescribing is such a huge problem for our older adults. And there are pharmacists out there who run deprescribing programs where they will review your medications and try to help you get off of things, because as we get older, our bodies don't even process the medicines the same way, don't get them out of our system as quickly. And so and also medications are not studied on older adults because older adults are considered a special class, right? So they're only studied on, middle-aged adults. And then, so we're being given doses that have never been tested in these age groups. And it can really mess with you. There needs to be somebody watching the medications, trying to make sure you're not getting too much of anything, that we're not double dosing, here's 2 different heart medications and all the things, because it's really on you to do it, because the doctors they don't have time. And I'm not trying to blame them at all. They don't have time in that 5 to 7 minute visit to look at you as a whole person, to look at all your medications, to do all the things.
And once again, that's why there is other ways. There are better ways. Direct primary care, advanced primary care, I think, can help you down that pathway. But the problem that we see is just like my friend Bill, is he had been seeing that doctor for 20 plus years. Right. He trusted that doctor. And we're looking at a group that we're talking about, these boomers they trust physicians. Mm-hmm. Okay. You get to people at a little bit different age. As you get into younger folks right now, they're more likely to question a physician and question a medication and question a treatment. Some of that, unfortunately, is because of Dr. Google, which is also that's a terrible place to look for what's wrong with you, because you always got cancer and you're dying. But anyway, That's neither here nor there.
Basically, already did.
Exactly. What's these symptoms? And it comes up, and it's always the worst possible thing. But my point there is they are less likely to question things. My parents have been, until I have been advocating them more and more. And I make them ask questions. And I can tell, in particular, my mom is very uncomfortable sometimes asking these questions that I've told her to ask.
Yeah.
But all of a sudden, those physicians look at people differently, because they're like, oh, they're not just going to take my word. They're not going to listen to me. Let me explain. Let me spend some time and explain this to you. That's what anybody wants, right? And if they aren't treating you that way and aren't giving you that respectfully, I'll tell you, find another physician. Find someone that cares enough about you to actually give you the information that you need to make an educated decision about your treatments.
Yeah.
People just don't do it, and it's unfortunate. All right, Fred. Hey, this has been very, very eye-opening. So what is your main goal, I know, is to help us change the vocabulary, is to help us change our perception of age, help us overcome our ageism, and that, what do you call us, an ageist? Help us overcome those things. What are some things that people can take away today, things that they can start making changes in their own life to help them see things different?
So I think the first step in any of this is recognizing our own internal bias, right? I can't tell you the number of times I've given presentations or talks and I'll say, how many of you know what ageism is? And there will be a number of people in the room who don't, who've never heard of it or they've never thought about it, right? Like it's not on their radar at all. And I think the first thing is realizing that you have been kind of cooking in this negative soup, right? Between the advertisements and the words and what we see on television, all the things that have kind of fed you this message that go, growing older sucks, right? And it's to be made fun of, right? Think about our birthday cards, right? Try to buy a birthday card for anybody over 50 and you'll see it very quickly. So the first thing is just kind of having that aha moment to go, oh, what have I heard? What have I been telling myself, right? Like what has been my internal monologue about my wrinkles, my hair, the way my spouse looks, whatever it is, the way I'm thinking about aging in the world. And if you really pay attention to that for very long, you will probably realize you haven't been very nice to yourself as you've thought about this. And then kind of paying attention to all the things you see or hear in the world that is feeding you that negative message. Because if we're going to change our perception, if we're going to try to change the way society even looks at this, the place we have to start is internally. We have to change our own outlook. We have to pay attention. We have to think about what we're saying. When somebody has a birthday and you tell them, hey, you look great. You can just say you look great. You don't have to say you look great for your age, right? That seems so silly, but that is such an ageist statement, right? Like, why do we have to talk about your age at all? Why can't you just tell me I look great or I can tell you look great? We don't have to put age in it. But we do this all the time. And once you start noticing it, you will notice it everywhere. So that internal look is, I think, the very first step. And if I could get everybody to start doing that and kind of reconsidering, that would be a tremendous change.
So all of these things, I'm sure, are addressed and much, much more in your book, Teenagers. Where can someone get a hold of a teenager's book?
So it is available on Amazon. It is also available anywhere books are sold. It's probably not in your bookstore, but they can request it and have it brought in. Please do. It's also linked on my website, which is CorinneAllman.com, and that's where you will find more information about me. You'll find all my social media links, everything there.
Awesome. Great. Definitely want to connect with you on social media so that as you post different things, I can share it out with folks as well, because I think you have an important message that, the age of it has come and I'm a little play on word there, but the age of it has come. I mean, we've got to change our thought process on this older generation because they're still incredibly robust, incredibly, I don't mean it to sound degrading, but incredibly useful in our society. I think that's another problem people face when they get to certain ages, that people just don't think they're even useful anymore.
Right. Well, and here's the thing. If you don't like how older people are perceived or treated or made to feel unuseful, right? All those things. If you don't like that, the only way for you not to have that same experience when you get older is for us all to start changing it now.
Absolutely.
That's it.
Very, very wise words, Corinne. Thank you so very much for being on the show today. I am super excited to share some more things with you. I'm going to get me a teenager's book myself because I think it'd be an excellent read. I have some folks I think I want to connect you with as well, because I think this would be great to spread the word on some of this. Thank you so very much for being with us. What's that website again?
It's CorinneAllman.com.
CorinneAllman.com, and you guys can go and find Teenagers there, or you can go out to Amazon and purchase it as well. Thank you once again, Corinne, for being with us. Thank you, folks, for being on the Health and Wealth Power Hour. Don't forget, you can also listen to one of my other shows monthly. We have the live broadcast every month of Why Does Healthcare Suck? That's right. Why Does Healthcare Suck? As we delve into the different crazy things that go on in our healthcare system and how we can address them. Maybe we need to have a Why Does Healthcare Suck with Corinne on to talk about how folks are not treated properly as they get older. Thanks again, Corinne, for being with us. We'll catch you guys next time on the Health and Well Power Hour. We are out of here.